Female barrier methods. The female condom. Common brand names are Reality, Femidom, Dominique, and Viamore. The female condom is a thin, soft, and loose-fitting sheath with flexible rings at each end. The inner ring at the internal end of the sheath fits inside the vagina and holds the condom in place during sex. The outer ring on the open end of the sheath stays outside of the vagina and covers the external genitals, which aids in removal of the condom after sex. The sheath provides a physical barrier that prevents sperm from entering the vagina and uterus to fertilize the egg and create a pregnancy. The female condom. Effectiveness. With perfect use, only 5 out of every 100 women who use the female condom unintentionally get pregnant. However, with typical use, up to 21 out of every 100 women may unintentionally get pregnant. How to use. You must use a new female condom each time you have sex. Squeeze the ring at the internal end of the condom and insert it into the vagina as you would a tampon. Use your index finger or the applicator inside the condom to push the internal end of the condom as close to the cervix as you can. Let the outer ring of the condom remain about 1 inch outside the vagina. Finally, note that the female condom may be placed up to 8 hours before sex. The female condom. Advantages to using the female condom are as follows. Female condoms can be found easily over the counter and do not require a doctor's prescription, can be used during both vaginal and anal sex, may increase pleasure, are safe for people with latex allergies, protect against sexually transmitted infections and HIV, and may be used while breastfeeding. The disadvantages of the female condom are that they may decrease sensation during sex, can be hard to learn how to insert properly, and may slip out during sex. The female condom. One myth is that female condoms are noisy. While that may be true with older products, today female condoms are made of soft, synthetic materials that do not make noise during use. Another myth is that female condoms can get lost inside a woman's body. This is not true because the opening of the cervix is tiny and will not allow the inner ring of the female condom to pass through and get lost. Finally, some believe that male condoms are better than female condoms. While male condoms are slightly more effective than female condoms with perfect use, with 98% effectiveness for male condoms versus 95% for female condoms cover the outside of the vagina and can offer more protection against sexually transmitted infections than male condoms. The diaphragm. Common brand names include Coroflex, Coromex, Dominique, Orthodiaphragm, Kaya, and Milex. How it works. The female diaphragm is a shallow cup in the shape of a saucer that is made of soft silicone and works by covering the cervix to prevent sperm from entering the uterus to fertilize the egg. For best results, the diaphragm should be used with spermicide, which is a cream or gel that kills sperm. Effectiveness. With perfect use, only 6 out of every 100 women using the diaphragm unintentionally get pregnant. With typical use, up to 12 out of every 100 women may unintentionally get pregnant. The diaphragm. How to use. Place about 1 tablespoon of spermicide into the cup of the diaphragm. In a comfortable position, like the one used to insert a tampon, pinch the rim of the diaphragm to fold it in half and push it as far up into the vagina as you can. Tuck the edge of the diaphragm behind your pubic bone to make sure your cervix is covered. You may put the diaphragm in up to 2 hours before having sex. If 2 hours have passed, add more spermicide to the cup. Leave the diaphragm in place for at least 6 hours after sex. Hook the top rim of the diaphragm to break suction and remove after use. The diaphragm. Advantages to using the diaphragm are as follows. Diaphragms can last up to 2 years with proper care, are very affordable, can be placed before sex to avoid interruptions, and can be used while breastfeeding because they do not have hormones. The disadvantages of diaphragms are that you need to see a doctor to get fitted and prescribed a diaphragm. You must use the diaphragm each time you have sex. Learning to insert the diaphragm properly may be difficult. Diaphragms do not protect you from sexually transmitted infections since the use of spermicide may increase the risk of getting HIV, and diaphragms may increase the risk of bladder and vaginal infections. The diaphragm. Some believe that the diaphragm can protect from sexually transmitted infections. However, the diaphragm does not prevent sperm from entering the vagina and cannot protect against sexually transmitted infections. Some worry that their partners will feel the diaphragm. However, when properly fitted, your partner should not be able to feel the diaphragm during sex. While some believe the diaphragm is custom fitted, it is not. Instead, your doctor will fit you for the standardized diaphragm sizes available in most pharmacies. Finally, the size of your diaphragm may change with your body size, especially after delivering a baby. You should get refitted and renew your diaphragm prescription every 2 years.